Let's talk about preparing for surgery. So, I think the first and most important thing really is timing. You need to pick a time for your surgery where you have ample opportunity to recover afterwards. It's always when you're on a short timeline that bruising and swelling takes longer to resolve. So, in general, I tell my patients not to have anything important scheduled for 2 weeks after surgery. In addition to picking the right time, you want to make sure that you are appropriately preparing your general health for surgery. If you're having IV sedation or general anesthesia, this will involve a trip to your family doctor or your internal medicine physician to make sure that all of your other systemic medical conditions are optimized as good as they can be before surgery. In addition to this, if you take blood thinners, it is really important to first check with your primary care doctor to make sure that stopping them is safe. And assuming that it is, make sure that you do stop them before surgery. Not stopping your blood thinners before surgery can increase the risk of having significant bleeding, and this can increase the risk of some very serious complications. So, stopping blood thinners is tremendously important. Some medications that thin the blood, like aspirin, need to be stopped a full 7 days before surgery. In addition to actual medications that can thin the blood, there are several herbal supplements that can also cause the blood to clot less well. These include vitamin E, ginkgo biloba, and a whole host of others. These are detailed on your pre op instructions, so make sure that you review any herbal supplements or vitamins that you take to make sure that these are stopped before surgery as well. The next thing is to prepare for the post op period, right? So, in addition to picking the right time to have your surgery, you want to make sure that you'll have everything at home you need to recover. This includes something to use for cool compresses because after surgery, especially in the first 2 or 3 days, it's really helpful to apply a lot of cool compresses to limit the swelling and the bruising. I find that little Ziploc baggies of frozen peas work really well for this because they mold and conform to the surface of the eyelid. So make sure you have that on hand at home. In addition to cool compresses, you want to think about your pain management. Now, again, we want to avoid things that thin the blood and increase bruising, so you should not plan on using ibuprofen. Rather, something like Tylenol is much better. And in most cases, taking Tylenol every 8 hours regularly for the first 2 or 3 days after surgery can help you stay on top of any discomfort. If you're having orbit surgery, usually we'll prescribe a stronger pain medication for you as discomfort can be more significant than after eyelid or lacrimal surgery. In addition to all of these things, you want to make sure that you find someone who can accompany you to the surgery. This is super important, especially if you're having IV sedation or general anesthesia. You want to make sure not only can this person accompany you, but ideally that they can stay with you for the first 24 hours after surgery to help you, especially in the event that there is a complication. Those are the majority of the things to think about in terms of preoperative considerations. Of course, you want to be well informed about what the purpose of your surgery is, why you're having it done, and all of these good things, which you'll have lots of opportunities to ask questions about.